Hey, it's Dave here. We are continuing our quest to try and figure out what might be causing your heartburn. And in this particular video, hopefully be a nice short one, we're going to talk about certain medications that are associated with an increased risk of heartburn and acid reflux. Now, this list is not my own. I put it together with the help of a tremendous little book called Why Stomach Acid is Good for You. And that's by doctors Jonathan Wright and Lane Leonard. And that's a worthy read if you'd like to go away and grab that book. It certainly taught me a lot about how various different factors can contribute to upper digestive problems. And in that book, they list a couple of different categories of medications that can either trigger or worsen heartburn and acid reflux. And so just as we talked about when we looked at food, there's a category of medications that seem to have the ability to weaken the lower esophageal sphincter. And we said, remember, that the lower esophageal sphincter opens out to allow food that you've swallowed into your stomach, and then it should shut nice and tightly to prevent the acid from splashing back up into your esophagus. And when it is loose and weak and it's not working properly, the acid can splash back up into your esophagus and cause acid reflux, which you feel as heartburn. Now, some of the medications that seem to be able to contribute to this, well, cigarettes, first of all, of course, are not medications, although people might use them to self-medicate in some circumstances. So cigarette smoking can be a problem in this regard. And then we have this broad category of medications called NSAIDs, and that stands for non-steroidal anti-inflammatory drug. And they include things like aspirin and ibuprofen or ibuprofen, and they are basically painkillers and anti-inflammatories, and they're very, very commonly used, and they can really irritate the stomach lining and loosen or weaken the esophageal sphincter as well. They're also heavily involved or heavily considered, shall we say, in the drugs that can irritate the gut lining as well as being lower esophageal sphincter weakeners. So the NSAIDs are a huge problem there for some people. Bronchodilators are the medications that are used for things like asthma and to help people breathe easier. Calcium channel blockers and beta blockers are used for cardiovascular issues, particularly high blood pressure. They can potentially trigger weakening of the lower esophageal sphincter as well. Then we have diazepam, which is an anti-anxiety medication. We have nitrates, which are used for the treatment of angina. And we also have Demerol, which is an analgesic. So any or all of these medications, if you're taking them, of course, if you're not taking them, it doesn't apply to you at all, but any of these medications, including cigarettes, can potentially worsen your heartburn and acid reflux symptoms by weakening the lower esophageal sphincter. Onto the irritants. NSAIDs we've already spoken about, but we can just dive into them a little bit more. NSAID use can actually cause such severe damage in the stomach that it causes bleeding, and that is not a good thing. So we do have to be really careful with non-steroidal anti-inflammatories. Tetracycline is an antibiotic, and most people are not taking tetracycline all the time, although there are some cases, some situations in which tetracycline might be needed over an extended period of time. Quinidine is an anti-heart arrhythmia drug, so it helps to settle down and make the heartbeat nice and consistent without these arrhythmias or these fluctuations and flutters. Iron salts are used to treat anemia. They can really irritate the digestive tract and create heartburn and reflux in some people. And then potassium chloride is used as a treatment for what's called hypokalemia, which is low serum levels of potassium. So these are all medications, again, that aren't really relevant to you if you're not taking them. But if you do happen to take any of these meds in the future and you feel your symptoms worsen, then you know that there's an association there. You can talk to your doctor about using something different, perhaps. Now, because I am not a doctor, at no point should you take this information as being a recommendation to stop any of these medications. Obviously, it would be lovely if you stopped smoking, but with any of these prescription medications, you've got to speak to your doctor about them before changing your dose or coming off them. There probably are some ways that you can come off them, and there probably are some alternatives, but don't even venture into the idea of stopping these medications on my word. Make sure you speak to your doctor first. So this is just a brief overview of some of the medications that can potentially worsen or create heartburn in the first place. And in the next video, we're going to talk about bad bugs and how dysbiosis and chronic infections in the digestive system can either create or worsen your heartburn. So hope this has been helpful. Any questions, please let us know, and I will look forward to talking to you again soon. Thank you.